Hello, everybody. Thank you for joining us today. For those of you who don't know me, my name is Peter Llewellyn. I run the services at MedComsNetworking.com. Services for the global MedComs community, by which I mean medical communications, medical education, medical publishing. Not just people who work within the business, but also people who are interested in joining the business, joining maybe as writers, account managers, event managers, editors, and so on and so forth. And there's a service at FirstMedCommsJob.com where you'll find lots and lots of free information, careers guides, articles, videos, and so on. And we run a number of events, and sometimes like this online, we can get people together from the different agencies and talk about what life is like in MedComs. Today I've got 5 agencies represented, very different sorts of agencies represented, and we're going to have a discussion about what's going on at the moment in MedComs and the career opportunities that are there. And we're very much going to be led by the questions from the audience. So audience, please do ping in your comments and your questions using the text boxes. So no presentations today, it's just a panel discussion, but we're going to start with some introductions. So Jane, over to you to kick us off, please. Thank you.
Thank you, Peter. My name's Jane Smith, and I'm a director at AMICULum. AMICULum is an independent healthcare communications agency with offices across the world. We've been in business for over 20 years now, and we have 9 specialist agencies within AMICULum, each of which offer a different service for medical communications, healthcare learning, digital and creative services as well. We currently have 250 team members across the world in the US, UK, Middle East, Asia and New Zealand as well. I've spent my entire career in medical communications. I started off as an editor and then moved across to project management and account management. And my current role within AMICULum is to oversee our US and UK agency operations.
Excellent, thanks Jane. So number 2 is Rebecca, please.
Good afternoon, everyone. My name is Rebecca Douglas. I'm the Programme Director for Allegro, and Allegro is the fast-track training programme for medical writers within Ashfield Healthcare Communications. Ashfield Healthcare Communications is a network of medical communications agencies, and we have over 1,400 employees based in the UK, the US and Germany. On a personal level, I've been in MedComs for over 16 years now. Starting as an associate medical writer and working my way up.
Excellent, thank you Rebecca. And Karen, you're next.
Good afternoon everybody, my name's Karen Kent. I'm the Senior Talent Acquisition Lead for UK, Europe and Asia Pacific with Envision Pharma. Envision is a full service medical communications agency, also with a technology arm. So we have a presence across the UK, US, Serbia, Hungary, Australia, and Japan. For me personally, I was a senior postdoc for a number of years, and then I moved into medical communications as a writer some 22 years ago, and I've stayed within the industry all of that time. I've been within recruitment for MedComs for 11 years, and I've been with Envision Pharma for 5.
Excellent, excellent. Thanks, Karen. And Diane, you're next.
Hello, my name's Diane Sutherland and I'm Professional Development Director at Fishawack Health. Fisherwork Health is an independent global MedComs healthcare agency, and we started up in 2001 with offices in Knutsford and Oxford. We're now over 800 and we have offices across the globe, mainly UK and US, but also we have people working from just about every country in the world, I think, at the moment. From my perspective, I've been with Fisherwork for 18 years, in medical communications for over 20 years, and like Karen, I started off as a research scientist and a postdoc for many years as well, but I've never looked back.
Excellent. Okay, thank you. And Petula, welcome.
Good afternoon, everyone. My name is Petula Coutinho. I'm a Client Services Director at Oxford PharmaGenesis. And for those of you that don't know us, we are a global independent health science consultancy employing more than 350 staff across 7 different sites, mainly with offices in the UK, Basel, Philadelphia, and also Melbourne, Australia too. We take a different approach to communications from some other agencies. We take more of a holistic, integrated approach, one that considers the perspectives of different healthcare stakeholders very much so, and not just the physicians, the payers, the policymakers, but really thinking about some of the important aspects, the patients and the caregivers as well. And we feel that that's critically important in demonstrating value for healthcare products in today's complex healthcare environment. As a company, we have a unique company culture, one that is described as one of a kind, and that gives every person within the company an independent voice, an opportunity to contribute to the development of the company. And this entrepreneurial spirit was very much there at the start of the company, and it is very much alive today and drives us to continue to innovate and enjoy the work that we do.
Excellent, thank you very much. Thanks, guys. It's worth saying that everybody here, there's quite a variety of experience here. We've all got a lot of experience, but we're coming from slightly different sides of the business, and each of the agencies is quite different, and that's what we're going to try and draw out a little bit in the next half an hour or so. But it is worth saying, if anybody's interested in more information about one agency or the other, apart from the fact you're welcome to contact the panelists directly via LinkedIn, as we'll confirm at the end. But you can go to FirstMedCommsJob.com or NetworkPharma TV, where all the videos are collected together, and you'll find that all these agencies, 4 months ago we had a Meet the Agency session, and we had a presentation from each agency. So you'll find information out on the websites and so on. Today I just asked for a brief introduction to give us a flavour of what we're of the group of us, and then I'd like to just sort of spend the next half an hour or so talking quite freely about life in MedComms and life at the moment. I said, well, I have said 4 months ago, or 5 months ago, we had a meeting when we were just all going into lockdown, and we were all a little bit sort of like, gosh, this is all a bit different, and how's this going to pan out? And you can watch that discussion if you want to, back on the website. But a few months later on, it feels to me like things were a bit different. Maybe in some ways a bit more settled, but quite different. But can I just run around everybody? Let's just face this up front. It's September 2020, just the end of. And if I just run around in a slightly random order here, what is the position? Are you open for business? Are you doing stuff? Are you in the office? And so on. So just give us a flavour, and let's get each of you saying a little bit. I'm going to just go a bit randomly with Rebecca first, sorry, and tell us what the position is at the moment.
Yeah, so I work on the graduate programme and the training programme, and as we went into lockdown, we had just contracted our last intake of writers, and we made the decision to go ahead with starting them on the programme. We trained virtually for 8 weeks, and those writers then went into their first rotation. And we've now gone through the process of recruiting for our next intake 9 on the Allegro programme, and they start on the 12th of October. So it's very much business as usual from an Allegro perspective, and certainly the agencies are very busy. Some of our offices are open, the others are preparing to open. In line with guidelines, people only work from the office when they have to, but for some people it's important that they've got that space. So yeah, we are business as usual. We've adapted, and Allegro is online for the foreseeable future.
Excellent. Okay, and it's possibly again worth saying, because we've got an international audience watching us today and maybe watching the video later. We're as I say, end of September, and there's quite a lot of sort of re-locking down going on in the UK at the moment. So not very many weeks ago, everyone was being told to get back to the office, and then suddenly we're all being sort of advised not to maybe rush. So people are perhaps at different stages of opening up offices and so on. So again, just touching on this and not getting bogged down in it, but give us a flavour. Diane, if I come to you next, how's it at Fishawack?
Yeah, pretty much the same. At Fishawack, we've, in terms of how business has been and whether we've seen any change, there obviously there has been some change, particularly in the event side of the business, because events are not running, but we're still doing events, we're just doing them virtually. So we're basically doing everything we were doing before, but we're doing them virtually. A lot of the stuff we do is virtual anyway, so it doesn't make much difference. People are working from home most of the time, but we do have our offices open. We were just starting to get people coming back in a bit more, and now, as Peter said, we're being told actually maybe hold back a little bit, but we're keeping our offices open so that people have got that option to come back in and work if they feel they need to. We're very, very busy. We have loads of business coming in, as all the agencies do. It's a busy time for healthcare, and all of our clients are involved in COVID in some way or another, whether it be treatments that they've got that they're trying out for COVID patients, or vaccines, or so that is making for some very fast turnaround, high profile work. So it is very busy, and we're still recruiting very fast. And yeah, lots going on, but we're adapting very well to the virtual.
Great, thanks. And that's partly what I'm trying to get out of here. You're recruiting at entry level, aren't you, Diane? Jane, I'm going to keep going. Jane, again, some of this is just the same, but let's just give a message out that MedComms is working, sort of thing. Jane.
Exactly. Very similar picture at AMICULum. Back in March, there was a slight pause. There were a few weeks while the clients kind of regrouped and figured out how to move their events to virtual, etc. But since then, the business has really taken off. We're extremely busy, like the other agencies at the moment. In terms of our offices, we had opened or planned to open most of our UK offices, and we've been, like everybody else, encouraging people to go back. In other jurisdictions, our Shanghai office was already open, New Zealand was open, Singapore was open for people to go back if they wished, so a similar situation in the UK. And we're back recruiting. We've got a number of different vacancies open at present at all levels, but a lot of them are trainees as well.
Excellent. Okay, Petula, if I can come to you next.
Well, Peter, like the other agencies, we're also very busy. We did experience, I think, a period of change in March when many of the congresses were deciding, what should we do? Should we go virtual? Should we just pause until next year? So I think we've had a learning curve as part of that. It's also tested our resilience in terms of being responsive and being able to be proactive with our clients and come up with some new innovative solutions that, you know, have actually helped Congress organisers as well. So that's provided a nice opportunity for us. It's also provided professional development opportunities for people who typically were on site, live at events, and now there are different ways of doing things. So lots of positive learnings that have come out of a difficult situation, which is great. In terms of our offices, we have some of our offices are open for those that really need to be in the office. Again, we're working in accordance with government guidelines. Our London office is open 1 day a week. And we're really looking at things on a case-by-case basis. The well-being of our staff is really important to us. So there are individual cases where people really do need to be in the office. That does happen.
And again, you're recruiting at entry level. You have been throughout, haven't you?
We're recruiting at all levels. We're exceptionally busy, and yes, the industry remains very buoyant at this unusual time. But I've been impressed by the resilience of people to just be committed to, you know, doing the great job that they've continued to do for such a long time, despite very unusual circumstances. And if anything, I think we're more connected as a company at Oxford PharmaGenesis than we were before, because those that did work remotely are now in the same situation as all of their colleagues. We're very much connected, and I think we've built some really strong relationships.
Excellent. Okay, and Karen, come to you. Same sort of basic question, but you are, you know, very directly involved in the recruitment activity there. You know, you're still recruiting, aren't you? How are things going at your end?
Absolutely. So we are still fully remote across all geographies. So we went into lockdown and it was pretty seamless. We had some good hiring at the end of last year into the beginning of this year. So of course, some of those associates included had to come on board remotely even at the beginning of this year. We were a little slow with the recruitment through April, May, June. We started to pick up again in July. We're recruiting at all levels, but particularly focused right now on our associate program. We're recruiting in the UK, US and Australia. And in fact, some of our hires, as others have mentioned, are just about anywhere in the world. So we even have somebody at associate writer level starting in Serbia shortly. So we're embracing the global piece. But for us, it's also raising the issue, as with everybody, of we used to like our associates in-house full-time with their mentors and really gleaning so much about what they learn beyond their immediate role. So really focusing a little bit differently on how that happens going forward in the remote world.
Okay. So let's focus in a little bit here. I mean, the purpose of today's session is to talk to people who want to come into the business at an entry level. Let's talk about the environment that's going on here. And again, just a reminder to the audience that you can text in your questions and comments. We've got a number of come in already. We'll be led by you a little bit on this one, but I just want to explore this a little bit because I find this sort of fascinating at the moment. And Karen, you just touched on it. You know, we used to say, and we would have said, if people look at the webinars from a few months ago, you've got to come in the office because you learn across the water coolers and hear what's going on, all of that. That isn't really possible at the moment. So let's just talk a little bit and get a sense of, and I'll bounce around a little bit, guys, a sense of how you feel that's going. You know, is it as seamless as some people are saying, or what are the challenges? There must be challenges. I do not believe there aren't challenges. So let's talk a little bit about the challenges. You bring somebody in, they're remote. How do they get a grip on the culture of the place, the organization? How do they understand what's going on around them? How are you dealing with that? And I'm going to start with Karen, please.
Okay, so we've been remote onboarding since the beginning of the year. So we really try to set everybody up with a sense of what the company is like, what the culture is like. And then going forward, it's all about really high level communication, you know, with the team and with the wider organization. You know, it's all about communication every which way. Some say over communicate, that works for some people, not for everybody. But really trying to give people a sense of what the company is like beyond their little world in their office and their space.
I mean, sorry, I don't want to ask the stupid questions here, but I want to try and lead this discussion a little bit. And maybe somebody else, Jane or somebody. Jane, let's go to you. If you know, I can imagine how you can teach a medical writer online or whatever. Okay, or you can train, support, and all this stuff. It's that other stuff. It's the business. It's the, you know. And again, is that just an obvious thing to say? And therefore, are you just obviously dealing with that? And then how are you dealing with that? Or do you see people missing out on that?
I would say it's certainly been quite a steep learning curve, and even though part of our onboarding process was always through remote collaboration because of the way that we work and we have teams in different locations, you can't get past the fact that for many people joining a company, it's about the social aspects, meeting people, and the social learning activities that happen as well. So throughout this, we really have to try incredibly hard to try and recreate all of those different types of interactions that you would normally just lean over somebody's shoulder in the office and ask a question. So it's not impossible, but it does require a lot more thought and kind of process around it. We've tried to start right from the point where somebody's accepted an offer, and we have a lot more touch points with people in the run up to them joining the company to reassure them, to show that we've got a process, etc., to kind of really demonstrate our culture in practice. And then, as I say, we have a kind of onboarding and induction program that we've always had in place, but we've had to switch many elements to remote learning. But on top of that, we try and put in just the little social catch-ups, the virtual drinks across locations, you know, all those little things that help people integrate into an organisation and find new connections across the business as well. And
okay, and Rebecca, I'm going to come to you. You're running the Allegro program. You've mentioned every 3 months or whatever it is, yeah. And you've got direct experience and contrasting experience, as it were. You've been running it, and they have to go to Macclesfield and spend 8 weeks in Macclesfield before moving out. You've already had one cohort. You're about to have another cohort going through this remotely. Can you compare and contrast and make any observations on what the differences, the challenges, or indeed the benefits of it are?
Yeah, indeed. So we were obviously acutely aware of the challenges of bringing in a group of people to the business in a remote setting, and I'm not going to lie, we were worried about it. In March last year, our intake started mid-April, so we very quickly had to revisit the whole program, and we adapted the entire program to online learning, such that we broke them down into smaller groups so that there was much more chance to interact in a Zoom forum. We introduced social aspects to the program because we knew that people wouldn't be sitting around a table at dinner time chatting. So the social aspects were compulsory, just like the learning was compulsory, really. Forced fun, as we like to call it. And then at the end of the 8 weeks, when they've completed the program, they go out, our AMWs go out onto 2 5-month rotations. So at that point, we introduced more touch points with them in terms of our interaction with them, and also we ensured that when the AMWs went out into agency, they still felt like they could contact each other, so that the intake maintained its identity. We organised more touch points with previous intakes so that they knew that there were other people that had gone through the process that they could talk to. And we ensured that there were people within the agencies that were calling them daily, initially, certainly, to make sure that they were really getting that human contact. And also we've been very clear with all of the associate medical writers and indeed the trainers that come in, that it's really important to do things like actually talk to people and have your cameras on so that you can see people, and all those human aspects that make us all feel a lot better when we're working remotely. So it's been a real learning curve. Some things have worked really well, other things we're tweaking for this intake. I think in terms of focus and in terms of interaction and getting to know the candidate, the associate medical writers, we've done that almost better in many ways than we did do when we were in the office, because we've made a lot more effort. I think that the associate medical writers do miss out on that hearing things in the office, and just turning to someone and saying, what do you think about this? What are you doing about that? I think that is different remotely, but we're all adapting, and you know, there are definite advantages, there are some disadvantages too.
Okay, and I know to some extent you all have the same sort of issue, but I was just thinking as you were talking, I mean, you know, with the Allegro program, you come into Maxfield, to the Ashfield sort of environment, and then you go out to one of a number of different agencies to work for a while, and then another one, and that's, you know, in terms of culture and so on. I mean, one of the things I do find quite intriguing of it is this whole discussion about culture and so on. But in that instance, those guys are directly involved in very different cultures sometimes. And again, it's you can imagine them walking into a different office and experiencing that culture, whereas it's difficult to see how that perhaps works online. So there's an interesting sort of challenge in there. Petula, I'm going to bring you in, and we've started to go down the medical writing route a little bit, or there's a certain sense that we're going there. And I just wondered whether you could just comment a little bit from more the client services side. I'm slightly being simplistic about what I'm saying, but I can imagine a medical writer, you can teach them, as it were, train them online. They've got some work to do online. The account management client services side is much more about being part of a team and chasing people and going and sitting beside somebody and saying, what the heck's going on? Have you got a comment on maybe whether there's any differences you're specifically seeing on that side of the business?
I think as I had mentioned, we are more connected, I think, as an organisation than we were before, and we did have a robust IT system that allowed us to just seamlessly connect. For our new starters, the feedback that we've had is that they feel they're very surprised and relieved at the experience they've had so far, because the onboarding, as Jane had said, starts before they arrive, so they get to meet their team before their first day. They know people's first names, they've shared a few sort of insights about themselves, and they know a little bit about their colleagues. We often find that sometimes people are scared to ask those very simple questions at the beginning, and so what we've done is just create sort of small teams groups so that people can ask those questions that they would do, and sort of just step over to someone's desk and quietly ask that question that they might have been embarrassed to do on email. So we've done lots of things like that, again, to recreate that office environment for people. But a lot of our training is on the job. We do have training programs as well, and more formal learning as well. We have a learning and development manager. So I think all the systems are in place to support people. we recognise the need for more connectedness. So that certainly when people are joining, there is more contact with their line manager, daily contact to begin with. There are more sort of virtual cup of teas and social events, and in between the work and the orientation with teams to get to know the clients, the company culture, and feel a part of our business, which is really important. There are some fun things as well. We have social committees that do quizzes and online competitions and things.
Okay, but I guess apart from the answer, I suppose it's worth making that point that within the MedComms agencies, you have got some very different roles. You know, medical writer, and people can imagine the medical writer is just sitting there writing a manuscript and that's it. You know, therefore, why can't they do that at home? So one of the points which I guess is already coming out, is that's not the case. You're part of the team. You're constantly liaising and working with people and whatever it is. But there is a difference between the writing editorial side and the account management, project management type side of it. So I get, okay, so you're all saying that you're coping with this, but you can imagine some of the challenges that are coming up. Diane, I wanted to pick up on, I think you were one of the ones who said, you know, you've got people sort of all over the world sort of working with you, particularly at the moment. One of the things I'm interested in at the moment is, and it comes back to the first point we made, you know, we used to say you had to come into the office and be in the office at an entry-level position, and therefore you sort of had to live within striking distance of wherever that office is and so on. Nowadays, as it were, at the moment, you're all sort of saying, well, we're working with people remotely. So Karen's mentioned Serbia, but Diane, you said all over the world. You know, is it, and there are a lot of questions coming in on this point, so I'm going to cover the whole lot in one go, I think, you know, does it now mean that wherever you are in the world, you can get an entry-level job with a MedComms agency because it doesn't matter anymore where you are? Can you just talk a little bit to that one? Firstly, what's the reality at the moment? And secondly, a little bit of sort of, well, where are we going with this? Because are we really just going to go, it doesn't matter where you are, the remote systems are so good? Or do we think there's probably some hybrid? I'm trying not to put words in your mouth. You run with it, Diane, go on.
Yeah, I mean, it's a good question, because we have, well, certainly we have always been of the mind that you really need to come into the office when you're a new writer or in any position, because so much of the learning is from sitting with your team and just absorbing what's going on round about you. And I still think that is an important part of it, but we're in a situation where we haven't got that option, so we're having to find workarounds for it. And we are, and I think all of us have been quite surprised at how much we've managed to achieve doing things virtually. However, I do think we've also recognised that there are some things that you can't achieve virtually. So it does mean that there's a ceiling that you reach, and you are having to work a lot harder to try and get people up to a point that and it takes a bit longer than it would if they were in an office environment. But I do think that we are looking at sort of home-based working and new people coming in, being able to work from home a lot more. We're studying how it's working. We've put things in place where, as we always do, we're kind of keeping track on how people are developing, and we'll be able to do that comparison soon, where we'll be able to look at people who have joined us in lockdown, and it's looking like they're going to have their first year pretty much in lockdown. So we will be looking very closely at how, you know, what has worked, what hasn't worked, and based on that, we'll be able to say for sure, actually, yeah, we can start, you know, allowing people to start from anywhere. They don't have to come into the office. But at the moment, it's looking very positive. But you know, we'll obviously sort of keep an eye on that and see what does work and what doesn't. And I'm sure that we're going to be able to come up with something that's a little bit less black and white than it was in the past.
Okay. Just out of interest, is anybody more? I mean, that's. I understand entirely what you're saying, but you're sort of sitting on the fence a little bit because this is a work in progress. We're waiting to see how it works and so on. So you're not actually saying to people, no, you can't apply from anywhere. But there's a fairly strong message in there that you're not sure that it's going to quite work as simple as that. Just out of interest, has anyone, as we sit here at the moment, end of September 2020, seeing a more definite future either way? Either we're definitely bringing them into the office because that's the only way it works, or actually we know it's not going to work like that. Or is everyone agreeing with Diane's comments there? Anybody willing to say that? Karen, you look like you want to say something, Karen. So go.
I think it works a little bit differently according to the team that you're in and the role that you have. I think we're alluding to the fact that some positions work far better remotely, others really benefit from being in the office. But I absolutely endorse that there's so much that you can learn by being with your colleagues in an office where you're all together that you cannot get remotely. I would also say for Envision Pharma, with regard to where we can hire and where people can be, we can only employ if we have an operating business in that country. So, for example, we are limited to UK, US, Serbia, Hungary, Australia, and Japan. So for anybody who's in Spain, Italy, France, think they want a job with us, unfortunately, that's a no, unless they're prepared to relocate to the UK, in which case they've got to consider settled status right now and all of those implications as well.
Just out of interest, sorry, and that's my ignorance showing, is that a legal
It's a legal requirement.
So,
yeah.
And that applies everywhere, does it? You have to have the operating entity in order to employ someone locally. Is it
at Envision Pharma, yes, for sure.
But
Yeah,
broader than
freelance is different.
No,
freelance can be anywhere, but for employment, yes.
Okay. Yeah. So I'm just getting at whether that's an Envision thing or a company thing, or it's a completely legal point. I thought there was more flexibility than that. Jane,
no, it's we've had the same advice from our tax advisors. We have to have a payroll or an entity in the country for corporation tax and other tax reasons. So
okay.
we couldn't employ beyond the locations that we currently have.
Okay. And is everyone else in the same situation there? That's not something I'd fully thought through before. Okay.
Mm-hmm.
Okay. We're getting lots and lots of questions here, which are a lot of them are very specific about qualifications and so on. And I don't want to get too bogged down in that. You will find a lot of other information on the FirstMedCommsJob website and lots of webinars where we talk about the qualifications and so on. So I'm trying to skip more around the idea of how we're working at the moment and the training and so on. Having said that, we're talking about entry levels. I can easily imagine how you're interviewing people over Skype or Zooms or whatever it is, sort of thing. Again, I think a lot of people are bringing that in anyway, sort of thing. Although it's different, isn't it, when you don't meet somebody face to face. The process is probably quite similar. Are you all? I mean, let's take the two sides. Writing tests for the writers. That's all basically as it used to be. Yeah, no differences there. Some questions about this. You're almost certainly going to get a writing test if you apply for a writing position. Just dealing with the account management side of it, again, it's a little bit different. Give us a sense of what you would be putting somebody through on the account management side. And someone did ask a question, actually. They sent a question in about making presentations and things like that. Just give us, can a couple of you just put your hand up and go, I'll talk to the account management side. All right, Rebecca, and then Petula. Just talk a little bit about how you're going to take on an account exec in this.
Yeah, so sorry, not from the account management perspective, but from the writer perspective, just very quickly.
Oh, all right,
we did do the whole we did a very similar process actually to the way that it used to be face-to-face. So we still did team building activities within groups when we were virtually recruiting. We did assessment centres for a half day. We did writing tests, although we brought that up front this time. And we did one-on-one interviews. So essentially we knew people just as well when we were doing it remotely as we do when we're interviewing face-to-face.
Okay, I'd like to push the account exec side because we've got a couple of comments coming in. We're concentrating on the medical writing side. Let's just concentrate for a little bit on the account exec side and Petula, just talk. And I'm just curious a little bit, you know, about that process of like presentations or tests or whatever.
Sure.
Let's just have a couple of minutes on that.
So entry level, we wouldn't expect anyone to do a presentation. We would have a conversation where clearly they would be required to discuss their appropriate skills, transferable skills from previous roles if they don't have any medical communications experience. We would be probably asking them to do an accuracy test, so just to assess their attention to detail, maybe even also assessing their sort of approach to prioritization of tasks, and also assessing their organisation skills and their sort of attention to financial awareness. So potentially some financial numeracy things as well.
Good, there's some good points in there about, and it's quite obvious how that differs from the medical writing side of it. But just out of interest, specifically on the presentation side, because we've got several questions and a question here, does anybody actually require an account exec wannabe to go through a presentation? And has that has it changed from pre and post lockdown? So several shakes, but Jane, you're nodding your head.
I can answer this one. Yeah, for some accounts, we have asked entry-level account team members to give a presentation, but generally that is a presentation on themselves and how they think they have the skills to fit the particular role. So kind of relatively easy to put together and hopefully not too stressful. But it just gives us a sense of the personality and their ability to pull together both academic skills and also other skills that they might have learned from work experience. We did that prior to lockdown for many roles, so we've just moved across to having those as a remote presentation instead.
Okay, and is it as simple as going, that's now just done on Skype or Zoom or something like that, and you just stand there and talk? Okay. Right, okay, we're starting to run out of time, which is frustrating me because we've got a load of questions here. Let's just, but I'm still wanting to talk around this idea of the new environment we're working in. We don't quite sure where it's going, but the hybrid office we've sort of touched on a little bit. I mean, let's just come back to that point, because we're sort of touching around this. It is still important to be in the office. It's, you know, and the hybrid office coming in and for some of the time and staying at home for the rest of the time. Again, can we all just nod ahead and go, the hybrid office is probably going to be some part of our future, sort of thing? Is it? Nobody's said we're going to shut the offices, have they?
No, I think we're getting a strong sense from our teams that certain team members want to be in the office, not just the trainees, but, you know, other people want to be in the office as well. Yeah.
Yeah, I know it's a bit of a soapbox for me, and you know, again, we ran a survey which was presented in June, which people can have a look at. You know, it was quite clear that a minority, despite the fact we're in a business which was going very fast in the direction of going virtually anyway, sort of thing, and a lot of people in MedComms shrug their shoulders and go, "But Peter, we were already working very flexibly." But it's a big difference to then turn around and go, "Right, you have to work at home." And the survey we've done and other people have done quite clearly indicates, you know, some people do struggle with it. You know, and you're all talking very positively about the support you're providing and all the rest of it, but that must be a concern. You know, I can come onto Zoom and be quite jolly and then turn it off and go and sob in a corner, sort of thing, you know. So the support that we're giving people, the management and so on, is really, really important in these slightly strange times, and we'd all just agree with that, yeah?
I think an office environment's really important for creativity as well in some instances.
Because you spark off each other
exactly
in that way. Yeah. Okay. I'm going to, I think, to be honest, I'm going to stop there for the video recording, if that's okay, guys. We've got a lot of questions and we can run through some of these very quickly. That's fine. Although some of those questions are just answered by some of the other stuff we've got on FirstMedCommsJob. But for the purposes of this, what I wanted to do was get a sense of the fact that MedComms is open for business. The agencies are actually quite busy at the moment, that you're all recruiting. Yes, there's some differences in the way that people work and so on, but actually this is still a very positive and supportive environment to be in. And that you are all putting in place those sorts of processes and platforms and systems and whatever. And looking to the short to medium term future, we just see more of this sort of thing, and this, again, this hybrid type thing might play out a little bit. But it is basically a slightly different world to the one it was a year ago, sort of thing. So I'm going to say, for purposes of the video recording, thank you to everybody for joining us. All the panelists have said they're very happy to be contacted via LinkedIn. That's the easy way of doing it. They've all got websites, whatever, but talk to them on LinkedIn, make contact there and go from there. And just a simple final comment, there's lots of information on FirstMedCommsJob, lots of videos on NetworkPharma TV, lots of stuff going on at MedComsNetworking.com. I'm very happy to help and guide if anybody wants to talk to me. Basically, I'm going to wish everybody a happy day, and all I'm going to ask is everyone to give us a little wave, because we like to have a little wave at the end, and I turn off the recording. But audience, don't run away, because we'll keep talking. So bye-bye, everybody.